Hi, great to see you all. Yeah, I'm here to serve you up with the desserts of these keynotes that we've just had. And it's going to be a bit tricky because the good thing about hearing 5 other keynotes is that I can sort of bounce off that a little bit. And the bad thing is that now I want to reshuffle my entire presentation. So the dessert is going to be eat and mess, I'm afraid. Let's see how we go. Yeah, I wanted to talk a little bit about the perspective of citizen science when it comes to hiccups in data, in ethics, because there are lots of them. So yes, I am all about democratizing science, and at the same time, I'm also very aware that that's a really nice catchphrase which doesn't have any easy pathway. Also just to mention, well, we already mentioned that I'm from the Hanze. We are shamefully underrepresented here today. I think we are with the 3 of us from the Hanze, which is really a crying shame because so much of what has been said today is very important for our research as well. So we would hope to encourage colleagues to come here next time. Also part of the Bridge to Health Consortium. Hanze is the primary research group in this consortium, but we also do this together with the Universities of Applied Sciences of Utrecht and Amsterdam. Just to check, how many of you are familiar with the term citizen science? And not just the term, but also what it is? There's quite a few, but less than half. Okay, that means that we'll get into the definitions, so bear with me for those who know all about it already. Yeah, there's a lot of definitions about. I just took 2 of them here. So one is slightly older, 12 years ago, which is a really nice one, summary. Research conducted with participation from members of the public or from what is referred to as amateur or non-professional researchers, which is really an important definition in highlighting the fact that most citizens are, of course, not skilled researchers, and they do take part in citizen science when they do. More recently, we have a colleague of mine from Utrecht, Rohda Schuling, who said, yes, that's true, researchers, lay public, but also other relevant partners, by which she means practice professionals, policy makers, all kinds of people that could have been part of the ecosystem surrounding a certain research question. And I know that citizen science as a term is often confused with terms like participatory science, community-based participatory research, participatory action research, patient science, patient public involvement, engagement. I very often get asked at conferences, so what's the difference between participatory action research and citizen science? Well, at Bridge to Health, we've adopted the view of the Dutch Research Council that citizen science is basically an umbrella term for all these kinds of participatory approaches, and that's how we use it. Unfortunately, the United States does it exactly the other way around. They say that citizen science is part of the umbrella term participatory approaches, and that's because the term citizen in the United States has a very specific meaning. It means sovereign, citizen of a sovereign country, really excluding all kinds of other groups in the country, whereas in Europe and other countries around the world, we don't have this distinction. So we can just use the term citizen and mean everybody in the country, whether they are legally here or not, whereas in the United States, that's not possible. So they are sort of going back from the term citizen science, adopting participatory sciences, which makes it really fun to do literature researches and just having to include 12 different terms to find what you want. A little bit on the origins of citizen science. Of course, now it is really, really booming, but it has been booming for a while, actually, and it's not as old as Methuselah, probably, but it is very old. Particularly in the natural sciences, it's very old. So we have a long history of citizens being involved with things like the National Bird Counting Day, where they really meet the need for large data sets. So this is, of course, what we need in the natural sciences, just fields like astronomy, ecology, air pollution, all these kinds of fields, they really need large data sets. And citizens are used as extra sensors, you might say, as extensions of the researchers, because otherwise it would be impossible to collect all this data. We also already have a bit of an older example of citizens being used differently in research. I'm a linguist originally myself, and when I was studying, I heard about how in the 50s and the 60s, a lot of languages were being documented, a lot of grammar systems were being documented around the world, and it was impossible for linguists to really grasp the finer points of languages that they weren't native speakers of. So they enlisted native speakers, for example, Native Americans, Navajo people, to become linguists and then write proper grammar systems themselves. So this was a different kind of citizen science where the citizens were actually trained to be researchers. Of course, that doesn't mean that it was also a very democratic process. I wasn't there in the 50s, but I can imagine that there was not a lot of acknowledgement of these indigenous or native speakers taking part in these kinds of researches. It does point to a more current development in citizen science where it doesn't just meet the need for large data sets, but where it's also used to actually empower citizens or patients, if you will, to have more ownership over the research process, more ownership over research questions, how data is collected, what data is collected, how the data is interpreted, and that all has to do with the democratization of research. So this is Bonnie. It's also in line with a British sociologist, Alan Irwin, who was really all about opening up science and wrote importantly about that in the mid-90s of the last century. And he sought to reclaim two dimensions of the relationship between citizens and science. One, that science should be responsive to citizens' concerns and needs. And I think we've already seen in previous talks that that could be a problem already. And second, also that citizens themselves could produce reliable scientific knowledge. And this sort of relates back a little bit, I think, to what Robert was saying about trust, that very often, especially in the medical domain, patients or citizens are protected by ethical procedures that also imply that they cannot be trusted to make their own decisions about what they share, what they don't share, how it is shared. These are discussions that we don't have a lot with patients themselves because all the regulations, all the procedures are already in place, and they're in place for a good reason, because we know how that went wrong in the previous century. But it also takes away a lot of ownership and agency from patients and citizens themselves. So why is it so important, in my opinion, to start including citizen science in the health domain? Ellen already talked about this a little bit, so I'm bouncing off her. She mentioned Bauer. I will first mention Olson from 2010, who already found that there is such a huge expansion of clinical knowledge, and it's way too vast to be effectively transferred to practice. There's just way too much that's being developed. We don't have the capacity to really translate that effectively. And Bauer sort of expanded on that. He came up with the numbers. It takes 17 years to be incorporated. Half of it doesn't get incorporated. I also know from a sort of side subject that I took while studying linguistics here at the medical faculty that even when it is incorporated, patients only do what the doctor says about half the time. So you can imagine how effective it really is. And also something that Robert already touched upon as well, who is served? And mostly the weird societies are served. And what are the weird societies? That's us. That's us in this room, because this is Western people, educated people, industrialized people, rich people, democratic people. Well, societies, but we're all part of that society. So when you don't use the capital letters, it becomes very interesting to use that in texts. But of course, we know that we are in a bubble as researchers. A lot of research is designed by us, top down, and it serves us, which makes a lot of sense. So this is really about the underrepresentation of groups and issues. Also, the gap between science and society really points to what Robert was already mentioning as well, which is the mistrust. Even though it may not be as big as we think, politics really feed off this idea that science is that we should mistrust science, or that we shouldn't all just take their word for it. So it's really trying to minimize mistrust by using citizen science so that a lot of citizens gain insight into how research is being done, and then maybe it's easier for them to see that it's actually very difficult to manipulate research and to manipulate data, so that it's not common practice, what we do. Another thing is that with the current health issues that we have, a lot of problems in society, we need a really strong focus on preventative health, because cure or treatments cannot solve everything that we are facing in the coming years. And when we look at preventative health, we of course go into people's own living environments, because that's where the prevention takes place. And if we don't use citizen science, then how are we going to go into people's own living environments? We really need to go into neighborhoods and take a look at context that people live in to see what do we need to do to make sure that our interventions actually align with what is necessary in terms of preventative health. And that also leads to citizen science very often being context specific. So when we do citizen science research outside of the clinic, like I do mostly because I'm not a doctor, I go into neighborhoods and I talk to people there, then I know something about a certain neighborhood in Groningen and the problems that are there. But that doesn't mean that I can translate that to a different neighborhood in another part of the Netherlands. And we need those very specific solutions, but that also poses a problem for the FAIR principles, because can we reuse that data? That was really important in Vinkhuizen with like earthquake problems and stress and alcoholism and immigration. We don't have other neighborhoods that have exactly the same characteristics. Maybe if I only have 5 minutes, 10 minutes, okay, that's fine, yeah. Well, I think Ellen was very right to say we should use these kinds of methodologies because it's the right thing to do, not because a funding agent tells us to. On the other hand, funders are using citizen science as a really magic term these days. So it's in almost all of the calls. And if you don't use the term citizen science in your proposal, then you might as well not write it at all, it seems. For example, before the summer, we had, from the Dutch Research Council, we had a call on the Key Enabling Methodologies program, aimed to developing knowledge and understanding on the use of the methodologies in solving major societal issues. This was about energy, but it was also very much about the health domain. And when we look at those key enabling methodologies, there were 11 of them, and 10 of them are part of characteristics of citizen science. 10 of them were exactly just verbatim how I would describe citizen science. And examples of that were participation in co-creation, ethics and responsibility, behavior, empowerment, experimentation environments, that's what we call our living labs when we do work in neighborhoods, meaning and awareness. So basically they were advocating citizen science, if you ask me. I'm going to skip that one. Well, like I said, it's easy to conflate the term citizen science with the term participatory science. There's all kinds of ways to define citizen science. We like to use different levels of citizen science to give some sort of footing in this complex field. Because, as I just said, we need to have some context specificity. We need to go to people's own environments to assess what that context looks like, to be able to work on preventative health, public health, and for that we really need these more intense levels of citizen science. So like the National Bird Counting Day, that would be contributory science, crowdsourcing, large data sets. The ownership of the citizens remains very limited. They don't design the question, they don't say what kind of data is being recorded, they don't interpret the data, they just census. And then sort of this list that I'm presenting here goes from citizens having more involvement with the procedure or the method, and that sort of aligns with more ownership. I think for patient science, for example, you would be looking at sort of the distributory level. You know, a lot of patients will be called to give input or to validate certain data, or to evaluate interventions through all kinds of methods. Participatory is already a little bit more involved. But then with co-creative, you really aim for a situation where the ownership is 50-50% divided, and you really want to work with citizens even before you make your research question. So you really want to have them work on the hypothesis in the beginning as well, to make sure that you're getting the issues that are actually important in that neighborhood or for that group of people. So that's co-creative. We also have examples of citizen science that is actually citizen-led, so the roles are completely reversed. For example, Tata Steel, like the emissions from Tata Steel, that was really a citizen initiative to start measuring those emissions for themselves, because they didn't trust the reports of Tata Steel themselves. Funny that way. And then they asked researchers to support them, to facilitate them. So this was really the other way around. In an ideal world, we would have more of that, but this is very difficult to attain. Also because funding bodies don't like to give money to private individuals. They like to give money to foundations or institutions, and rarely the citizen is already organized enough that they are a foundation or an institution. So there are some barriers to that. So one example maybe to give is the work that we did in Vinkhuizen for a few years. We wanted to make the neighborhood more exercise friendly. So I have to say that was a question that we had. I work at the Institute for Sports Studies, so of course I do a lot with movement and exercise and active lifestyle. So this is something that we had funding for, to go into the neighborhood. But from there on out, the field was open. So we just tried to get engagement from people in the neighborhood, make sure that they wanted to participate, and then ask them, how do you feel about the exercise friendliness of this neighborhood? What hinders you? What helps you? No. So we went through all these kinds of primarily qualitative methods, of course, to have an intervention where we made two separate routes throughout the neighborhood, one more focused on art, one more focused on movement, that people were happy with. Of course, we ran into a lot of ethical issues or things that we thought were problems with that, because, a very solid qualitative way of gathering the people you do research with is snowballing. But even when you snowball in an area like that, you don't know which people you're going to get. So mostly you get people who have time. So either they don't work or they are retired. You have people who already know a little bit about doing research and could be, energized to work on that. So maybe they're not the average citizen. Maybe they already know a little bit about research. Of course, you get the people who have a very good command of the Dutch language, which in Vinkhuizen is, well, maybe the majority, but there are also a lot of people whose language is not Dutch, the first language. So these are already issues. And then when we wanted to assess impact of the routes that we established, to say like, well, an exercise friendliness has actually gone up in this neighborhood, we ran into other problems with the data, because then we would have to ask citizens to sort of monitor other citizens, aka their neighbors, on how they used the routes. We had some ethical issues with that. So there's lots of stuff that comes up with a study like this. Also with the ethical review board, of course, we had an original research question, but we wanted to have an open field afterwards. We wanted to be able to allow room for emerging issues, for things that came out of citizens themselves. Otherwise, we could have just said, we're going to do this project and this is what it's going to look like. But ethical review boards don't like to approve procedures that are unknown to them. So this was also an issue. And then there's the whole general issue of maybe more from the medical perspective, that you are working with a group of people who are both researcher and research subject. And these are two roles that we traditionally separate. That's the whole of the medical field. We separate these roles. And that is exactly what we're we're combining in citizen science when we do it at the co-creative level. And of course, there's a lot of ethical issues with that as well. How do you do that? And who is the owner of the data? And questions to do with also, what's it called? Remuneration. So we were walking in the area as paid researchers. They were doing everything voluntarily. So how do you work with that? And then there's people who like to get some payment, and there's also people who are offended by being offered payment because they just are very motivated to improve their neighborhood. So just one project left us with a lot of difficulties. This is a different project I will not get into right now. We are connected to Citizen Science Netherlands and also to the European Citizen Science Association. Both have working groups on the health domain specifically. I already talked a lot about this, so I'm just going to skip that. Let's see, I think I mentioned most of this as well. Yeah, let's go a little bit into this one. So in terms of terms that we've heard before, I thought it was really nice the distinction that Ellen made between the three kinds of fair. I think citizen science, the second kind of fair, the one with only the capital F, is really important in the field of citizen science. This one, the acronym, might be a little bit more difficult. Like I said, even if we only focus on metadata, if data is very context specific, it could still be very easily traced and identifiable, which is what we don't want. For the rest, I think findable, accessible, interoperable could be okay for citizen science. Reusable, again, when it's very context specific, I wonder how much use we get out of generalizing or making it broader. Not sure if that would work. So I still have a lot of questions. I don't know if you have questions, but I myself also have a lot of questions. Yeah, that was it.
Lots of questions. This was a beautiful eaten mess of a dessert of a weird citizen.
A weird citizen, yeah. Like you and I.
Yeah. I was wondering, I also heard, Ellen, where are you? Ellen Carbo. Yeah, Ellen. My insight also from her presentation was it's not just about sharing an article or just plain data. There's other things to share. For example, a training or a manual how to do things.
Yeah.
Concerning this Finkhausen movement experiment that you did, making it more exercise friendly, what would the things be that be worth sharing about this to other researchers that might want to do this research in Bayern or in Amsterdam in the Baarsjes?
Yeah, that's a really good question. And I sort of came up, take credit for this idea that I think the impact of citizen science or the output works like a Matryoshka doll. So that there's levels of, and in the middle you have this just the traditional, the solution to the problem impact. You know, there's a problem with exercise friendliness and we have a solution to that, we made the routes. And that might be too context specific to share. But then in the second level, we of course made an impact on citizens by having them participate as a citizen scientist. They learned things, they trained, they got new connections in the neighborhood, they got new connections to the municipality, to research institutions.
You're actually there, boots on the ground, also influencing the whole context with what you do.
Exactly. And how we engage those citizens and what kind of methods we use to work with them to come up with solutions, that's something that we can share.
Yeah.
And then there's another layer that working like that with citizens also changes us as researchers, and it changes our research procedures at the Hanze, because we gain more and more insight into what the problems are and what works.
Can you give an example of how that changed you as a researcher, or insight into what the problem was?
Well, I am now, together with colleagues who are here, we are in intimate conversations with our ethical review board to change certain assessment procedures that are really a barrier to this type of research.
Yeah.
Yeah. And we want to...
Based on the research that you've done in that context, you're really trying to make that easier, to make it...
Yeah, for instance, having different kinds of informed consent, but also giving an approval in hindsight. So for example, for the emergence problem, letting a research group start and then having checkups, like is what you did ethically sound? And then we give sort of an approval in hindsight, but reserve the right to cancel the project if you didn't.
Wow.
Yeah.
So more process-based and iteratively and checking up on things and learning through that.
Yeah.
A robot is like wildly doing, You're like really agreeing, I think. Or is it something else that you were...
Yeah, we were just discussing...
Wait.
You wanted to keep it
I'm going to bring
private,
you the cube.
right?
We were discussing the issue of the medical ethical approval in hindsight and what consequences that could have for the rest of the world. This is that is a very big thing.
Yeah, and it links to that second thing from Erwin, like. Can we sort of change our perspective to one that we are trusting people again to make decisions for themselves? That if we as researchers and they as citizens are sitting together and we make up the rules of the game that we're going to enter, then that should be enough. And I do understand there's lots of problems with that. And on the other hand, I don't see how the field can move forward if we don't. Also bearing in mind that researchers, of course, are citizens. You know, it's not that... Yeah.
Beautiful throw. I have time for one last question, and otherwise we'll... In the back over there. I'll try to throw it... Yeah, well.
Thank you for presentation, very interesting. Yesterday there was an event, Mental Health in AI. My colleague was there, and she said there were a lot of people, like general people, citizens there. And I realized that there is a trend with mental health where I work, that people are more aware of it and more aware of science, more aware of results, and they seem to tend to wanting to be involved in it more and more. And so I was wondering if you also see that people want to get involved in research more actively, and how can we also kind of moderate it, because like you show classification, I know there are stages of kinds of participatory research, not clear how to choose and how to coordinate it all. Yeah.
So advice on how to include them?
How to decide, how to moderate it all,
Yeah, I think that's a good question, and particularly in the mental health field, I see that there's a lot of development now in training for experiential experts. So this is a type of citizen that you could involve in your research, and it's also quite easy for us to involve them because they're already receiving the training, and these people are often motivated by their own suffering that they want to relieve for other people. Of course, mental health is a huge issue, so there's lots to relieve. And these kinds of educational programs that we also have at the Hanze, for example, really help to get people skilled as researchers while retaining their point of view from an expert on experience. And I often classify the people in the ecosystem of a citizen science project like that. So I have the professional expertise and you have the experiential expertise, but it's both expertise. So this is one way that we work with people. And of course, also this has been a lot of debate in the Netherlands in general, but we see that a lot of people are actually really interested in doing research because people are naturally curious. I mean, we are all naturally curious if it's not beaten out of us as children. So a lot of people like to know new things and do new things. Yeah.
A beautiful eaten mess of a last presentation. Rohda Schuling.